What is multiple sclerosis? Dr. Fernando Dagon states that MS is a disease of the nervous system that uses the immune system to attack the myelin sheath of healthy nerves. It shorts them out, making that part of the body not work. That is how Dr. Lee Archer, head neurologist at UAMS Medical Center, explained it to me at my mom's first visit. MS is a very crippling disease, and it only hits certain people, but just who exactly? Who knows? Science is still not sure and are baffled to this day about this. MS has been dubbed the silent killer in that there is no known cure and it can strike without warning, and even with treatment, death is imminent, though it may take years. I stated earlier that MS is an autoimmune disease, but I will elaborate further by saying that it is primarily a disease of the nervous system as a whole. Some symptoms are numbness in the extremities, hands and feet, tingling sensations in random places. Fatigue and confusion, and more severe symptoms are optic neuritis, temporary blindness, falling down a lot, and eventually not being able to sit up or walk on your own. Carol D. Sarkinson, MD, says in MS, Early Signs and Symptoms. Early medications for MS were not so much because they didn't know anything about the disease. It was brand new. So you really only had beta-seron injections given subcutaneously to slow the progression. You had Neurontin for nerve pain and Valium to relax the person. And newer medications, just to name a few, are Ponvory to reduce relapses and brain lesions, Ocrevus injections to reduce disability progression, and Plegridy for relapsing remitting disease and secondary progressive disease, which is when you relapse and then you go forward again and you get worse and worse. And lastly, physical therapy, of course, to keep the muscles active so they will not atrophy. There is no known cause of MS, but we do know that most everyone carries one of over 200 genes that can cause it, but it is unknown what activates this gene, says E. Cantor in his article, Is MS Hereditary? Let's talk briefly more about symptoms and the severity of the most common. As previously stated, 1, optic neuritis that can last for days or even months. 2, violent muscle spasms and tremors sporadically and in different places. 3 is losing your ability to walk, talk, write, and more. These are gradual changes. When a person loses their ability to write, walk, and talk, it's usually done like you go from walking to a cane to a walker to a wheelchair. Writing is the same way. You write good, then you write gibberish. Talking, you talk fine, then you slur, then you just can't talk, and so on. And then you just go to be completely losing that ability. And finally, with end-stage MS, this is referred to as the end of the line in layman's terms. All treatment has been done with little or no success, and eventually the nerves that control our main organs, such as your lungs, your heart, and brain, basically stop working. As in my mother's case, her lungs could not expel the fluid, and she pretty much drowned. Once patients reach the end stage, it usually lasts maybe a month or so. I referenced A. Petrolango's 2021 article called What to Know About the Final Stages of MS. In conclusion, MS was a part of my life for 30 years, back when medications were not available and the disease was brand new. Everything I've learned about MS was through life experiences and first-hand encounters, and mentoring from the most renowned neurologist in the United States, Dr. Lee Archer. It is because of everything I've seen and done to treat my mother that I'm now seeking my doctorate degree so I can be part of a team to find a cure